So, good day as continuation or reporting of Alpha 7. So, I am your first reporter for Alpha 8. So, physical test for alcohol. The subject is directed to stand straight, heels together, and closed eyes for 1 minute. If the subject is drunk, he will not sway to the front or side. So, meaning, uh, he should put his legs or her legs together and his or her eyes closed for at least 1 minute. So, if he's drunk or under the influence of intoxicating alcohol, he might be stumbled. Next. So number two, ask the subject to stand with 1 foot ahead to another, so the toes of 1 foot ahead of the other uh, touches the heel. One of if he or she is drunk, he will either sidewise fall or sway. So meaning, as a police officer, ask the subject to stand 1 foot ahead of other toes. If he or she is drunk, the subject might possibly sway sideways or otherwise fall. Next. So number three, let the subject bend down and pick up small object from the floor. If he stumbles, it may be an indication of drunkenness. So command the subject to bend down to try pick up some object in the sideway. If the subject stumbles, meaning it is an indication that he or she is drunk. Next, please. So number four, let the subject pronounce the word truly rural and note slurring of speech when drunk. So if the subject is drunk, he can't pronounce well the word that is stated in number four. Next, please. So test for alcohol. So alcohol blood test is widely accepted and directed method of determining the concentration of alcohol in blood. So, if there is 0.5% or less by weight of alcohol in a person's blood, meaning he is not under the influence of alcohol. So, if you have 0.15 or more by weight of alcohol, meaning you are under the influence of intoxicating alcohol. Next, please. So, breath analyzer. So, a breath alcohol test measures how much alcohol is in the air you breathe out. So, the device used that measures to estimate how much alcohol in our blood. So, that number is known as your blood alcohol content. No? If you have 0.15 or less, you are not drunk or you're not under the influence of intoxicating alcohol, which opposites 0.15 or more, uh, which means kung you are under influence of intoxicating alcohol. Next, please. So, metabolism of alcohol. All chemicals that enter our body are broken down within the body and transformed into uh, other chemicals that are easier to eliminate. Or the word eliminate, to dispose or tanggalon sa ato body. So, the process of metabolism consists of three last steps. Number one is absorption into the bloodstream. So, meaning, once it is in our stomach, ato gi-intake, alcohol is absorbed directly into our blood streams through the tissue lining in the stomach and small intestine. Number two, distribution throughout the body. So, through our bloodstream. So, alcohol is carried to all parts of our body by blood circulation. And lastly, the word elimination, yung pagtatanggal ng alcohol sa ating katawan. So, through mechanism of oxidation and excretion. So, ato paano? So, more than 90% of alcohol is eliminated by the liver. So, and the rest, the 2% or 5% is excreted and changed in urine or yung pag-ihi, sa sweat, or sa breathing. Next, please. So, absorption and distribution. Ethyl alcohol, an alcohol, is a clear liquid with aromatic odor, normally diluted by water and consumed as beverage. So, alcohol appears in the blood within minutes after it has been consumed and slowly increases in concentration while it is being absorbed from the stomach and small intestine into the bloodstream and carried to all parts of our body, which means nadi-distribute yung alcohol throughout our body. When alcohol is absorbed, is completed, the alcohol is distributed and informed throughout. Ito yung nadi-distribute through blood circulation. Next, please. So, the water portion of our body that is through about 2/3 of the body volume, after absorption is completed, a maximum alcohol concentration slowly decreases until it reaches zero again. So, kaya nga kanina, yung elimination, bumababa or tinatanggal ng katawan natin yung alcohol. So, beer is absorbed more slowly than equivalent concentration of alcohol and water. Bakit nga ba? Kasi beer contains carbohydrates. So, alcohol consumed on empty stomach is absorbed faster than equivalent amount of alcohol taking when there is in a stomach. Note, no? If we drank alcohol with an empty stomach, the alcohol passes directly into your bloodstream or nadidistribute agad. Next, please. So, elimination of as the alcohol is circulated by the bloodstream begins to eliminate it. Yun nga, inulit ko, tinatanggal. So, alcohol is eliminated through mechanism of oxidation and excretion. All the alcohol consumed is oxidized to carbon dioxide or CO2 and water or H2O, which takes place in urine o yung pag-ihi with the presence of enzyme. So alcohol dehydrogenase, no? Alcohol is converted into acetaldehyde and then acetic acid, which there oxidizes to carbon dioxide and water. The remaining alcohol is created and changed by the breath. Kaya nga tayo pag nakakainom ay nangangamoy through urine and perspiration o yung sa sweat. The most significant amount of alcohol exhaled in the breath is in direct proportion to the concentration of alcohol in blood. Next, please. So, Republic Act 10586. So, ano nga ba ito? Ito yung Anti-Drug and Drug Driving Act of 2013, which is signed by President Aquino in May 27, 2013. So, it is an act penalizing persons under the influence of alcohol, dangerous drugs, and similar substances. So, under the driving under the influence of alcohol, an act of operating a motor vehicle while the driver's alcohol concentration level has received the level of intoxication. Next, please. So, field sobriety test. So, standard test to initially assess and determine intoxication. Ito yung ginagawa ng mga law enforcement para malaman kung isang tao ay may basihan na siya ay under sa intoxicating alcohol. Example is overspeeding. So, ano nga ba yung overspeeding? Ito yung pagpapabilis ng pagtakbo ng isang sasakyan na maaaring makasira or makapatay ng tao or makakause ng disgrasya. So, the penalty for overspeeding ranges from 1,200 to 2,000 pesos. Depende sa lugar. Next, please. Lane straddling. Ano nga ba yung lane straddling? So, this denotes the center of a two-lane road as the picture provided or marks the division between the lanes or multi-lane roads. It is always a reminder to stay in your lane. Kapag ang isang tao ay lasing, hindi niya na alam kung saan siya lilinya or yung anong assigned road niya. So, next please. Sudden stops. Sudden stops, if you notice that another vehicle is braking suddenly, yung biglang humihinto, keep your vehicle as far as away from theirs as possible upang maiwasan ang pagbubungguan o aksidente sa daan. Next please. Swerving. Ano ba itong swerving? So, swerving, the vehicle shifts from a lane to another or to turn aside from a direct course of action. So, sa Tagalog pa, ito yung pagliliko-liko, no? Parang walang straight line na dinadaanan. Ito ay may posibilidad na makakos ng disgrasya. Kasi nga, hindi niya sinusunod yung rule na keep always right when in terms sa highway. Next, please. So, poor coordination. So, poor coordination is mostly affects our motor skills when we are under the influence of alcohol intoxication, such as our eyes, hands, and foot coordinations when we are drunk. Ito yung mas delikado kapag tayo ay nagmamaneho ng sasakyan. Next, please. So, evident smell of alcohol in person's breath. So nakita ay nasabi ko kanina, through eliminations, lumalabas yung alcohol natin base na rin sa breathing. Kaya ginagamitan natin ito ng breath analyzer upang malaman kung isang tao ay under nga ba sa influence ng intoxicating alcohol. Next, please. So, if the driver fuels sobriety test, it shall be the duty of law enforcement officer to implement the mandatory determination of driver's alcohol concentration through the use of breath analyzer. So, a driver of a motor vehicle is involved in a vehicular accident resulting to the loss of human or physical injuries shall be subjected to chemical test or yung tinatawag na sobriety test. Next, please. So, refusal to subject oneself to mandatory test shall be penalized by the confiscation and automatic revocation of driver's license in addition to penalties provided. So, ito yung pag ikaw ay lumabag or ayaw mong pumayag sa mandatory sobriety test, you will be penalized for confiscation of your license. Next, please. So, penalties. Under the influence of alcohol which did not result to any physical injuries or homicide, uh, there are 3 months of imprisonment and 20,000 to 80,000 pesos. So, next is with physical injuries. Ito yung nakakasakit ka na or nakadisgrasya ka na ng ibang tao. So, magbabayad ka ng multang 100,000 to 200,000 pesos. And lastly, kung nakapatay ka na hindi mo sinasadya or without deliberate intent, magbabayad ka ng 300,000 pesos na penalty. Next, please. So, kung non-professional driver's license shall be confiscated and suspended for a period of 12 months or equivalent sa isang taon. Pag professional license naman, it will confiscated and perpetually revoked for first conviction. So, kahit na first conviction mo pa lang ay it will perpetually revoke or matatanggalan ka na ng lisensya. Next, please.
Death or injuries other than application of physical force. Thermal injuries or deaths. Deviation from normal temperature providing cellular or tissue damages. Exposure to secure cold will reset to frost bites and exposure to high temperature will result to burning or scalding. Exposure to severe cold is not common in tropical countries like ours. The cause of death is attributed to decrease in dissociation of oxygen from hemoglobin into the red blood cell resulting to decreased power of tissues to utilize oxygen. Exposure to extreme cold will result to production of frostbite or trench foot consists of several stages or phases. So, hod sa ato na which is a tropical country, the Philippines, which is warm kay mas grabe ang exposure sa sun. Once na ma-expose kita sa cold temperature, ang ato lawas mabaguhan kay tungod dili kun anad so prone kita sa frostbites. So, ang oxygen sa ato lawas na nagflow, maapektuhan sab kay kung ang level ng hemoglobin nat na nagdayan ng protein pasingod sa red blood cells na nag-carry ng oxygen, kung dili ni makakuha ng sakto na oxygen para mo function ang mga cells or tissues, mubati kita ini ng kaluja or mag-apas kita sa ato ginawa, mapektuhan na ato breathing. So, kung grabe sa ba nato expose sa sa cold na temperature, ang nato skin maka maka-experience ng different na stages ng frostbites. So, these are the stages of frostbites. First phase, bleaching or pale color the skin due to vascular spasm. So, sa first stage ko no, like for example, ang ato hand, tumukuan kita sa cold na temperature, mo makita nato na manluspad ini or sa lain na term mo, pa ini, manimas sa mo sa first stage. So, sa second stage, erythema or red color of the skin, swelling or edema due to vascular dilatational and decreased capillary permeability. So, for the second stage, kay makita nato sa ato hand na there are red dots na na-form tungod sa katignaw. Sa third stage or third phase, there is a blisters formation. So makita na nato ni sa ato skin na zaw na nagburot once na ato ni puson ang isuyod ng ini kay tubig. So sa fourth phase, there is necrosis and gangrene of tissues. So kung sa ato na lima makita nato ini sa tip na nato fingers which is ma-block siya, amora siya na luto. So these are the stages. So this is the first stage which is mag-failure siya. The second stage frostbite, mura mag-red da. And this is the third, which is blisters, the third stage. The fourth stage, which is mag-black ang tip ng ating fingers sa marsisan na naloto. So this or injury from exposure to heat will result to general or systemic effect. First, heat cramps, involuntary spasmodic painful contraction of muscles due to dehydration and excessive loss of chloride by sweating seen among workers working in rooms with high temperature with profuse sweating. So for this kind of injury, like sa workers who works in a high temperature, grabe ang loss ng ila sweat. So once na ma-dehydrate na sila, na-experience na nila ang inina na effect ang pagbinhod na nila siki. Second, heat exhaustion or heat collapse, heart failure, primarily caused by heat and precipitated by muscular exertion and warm clothing. So, tungod isab sa hot na temperature, amara mabati kita ng pagka-uhaw na ma-result ng pag-collapse ng ato heart or mura maka-cause ng ano ni na maka-cause ng heat stroke na kasagaran mahitabo once sa grabe mo exposure sa high na temperature. The third one, heat stroke or sunstroke, occurs among their working in the late and ventilated phases with dry and high temperature or due to direct exposure to sun. So this kind of injury may taboy ni kasagaran sa like sa construction workers. Grabe ang exposure sa hot na temperature which is grabe an effect sa ila brain. So they are prone to this kind of injury. Effects of application of heat. First, scald caused by hot liquid, or injury produced by application of liquid at a near boiling point or in a gaseous state. So this burn caused by like a boiling water. Once na mahuwa din sa imo skin, ang result ng ini blisters like the picture like just like the picture. Second, thermal burns, dry heat. Application of heat or chemical due to substances to the body. It is product by fire solid substances, friction, and electricity. So like kung magpasok kita ng mura bakal, kung paso na gani siya, once na matouch down sa imo skin, amoy niyang mahitabo. Layer sa first one, which is makahimo siya ng blister, which is water and ilayom. This one is platra. So, once na ini na klase ang imo burn, niabot na ini sa inner nemo na skin, which is the dermis.
Classification of burns. There are five classification of burns. which is thermal, chemical, electrical, radiation, and friction. Burns are classified by degree, depending on how deeply and severely they can penetrate the skin surface. It may be impossible to classify a burn immediately when it occurs. Thermal burn, it is a burn to the skin caused by any external heat sources. Example of thermal burn is scald from steam or hot or molten liquid. Then the second is chemical burn. Chemical burns are tissue damage caused by strong acids, drain cleaners, paint thinner, gasoline, and many other of substances. Like for example is yun mga acids, mga mga acid naming kuan sa ato panit. Then the third is electrical. An electrical burn is a skin burn that happens when electricity come in contact with your body. When this happens, the electricity can damage these tissues and organs. This damage can mild or severe and it can even cause death. It depends sa ano ni kung halimbawa yaon ma-off din ang plangka kung makurintihan man ang tao depende na pag masunugid ang isa ka tao or mapatay siya. Then the fourth is radiation. Radiation burn or dermatitis is common side effect of external beam radiation therapy to treat some forms of cancer. Ang example kadalasan ng radiation burn is overexposed of X-ray radiation, ultraviolet radiation. Then the last is friction. A friction burn is a type of abrasion that occurs when the skin rubs against another surface. It is also known as rope burn. Yan murag mag-rub ka gaya ng imong panit. 'Di ba may magkakosab siya ng heat. Then despite the name friction burn aren't really burns, but since friction generates heat, extreme pieces can cause the outer layer of the skin to burn. Next, please. Karas- kara- Characteristics of burns. Redness to complete carbonization. Then second is singing of hair and carbon deposits within affect area. Yun mangunot dayon ang imo something panit. Then third is wheat burning in conflagration. Classification of burns by degree. The first degree is simple redness and slight swelling may subside after a few hours. The second degree is vesicle information. With acute inflammation caused by flame, the skin is blackened and surging of hair. Scar, scars not present after healing. Third degree is destruction of cuticle. Part of true skin. Burnt, ari, burnt area is painful leading to the exposure of the nerves endings. Healing may leave scars. Ewan, magpabilin dahil ang scars sa imo panit. The fourth degree is whole skin destroyed with formation of slough. Surface is recreated, then the healing produce fibrous scars, may contact and produce deformity. Amo yun kuan something ugahay na ayun magsugod-sugod pa pagka kuan ang imo scars magpagka dayaw-dayaw. Then the fifth degree is involvement of deep fascia and muscle, produce severe scarring and deformity. Yun, medyo makuan na klaruhay na gid ang scars. Then the sixth degree is sharing of limbs, organs, and bones. Death due to shock, 72% of human body weight is water. Proves that the victim is alive before burned to death. Is the burning the cause of death? Number one is presence of smoke in the air passages. Greenish black material adherent to the mucosa of the larynx through trachea and bronchi. Then the second is increase of carboxyhemoglobin blood level. Carbon monoxide enters body through respiratory tract. Then carboxyhemoglobin is responsible for the cherry red color of blood on a fire victim. Then number three, or the last is erythema, edema and vesicle formation. Show the circulation was present and heat was applied.
I'm a port reporter in Alpha 8. So first, heat stiffening. Found in dead bodies subjected to heat, heat coagulates the albuminous materials inside the muscles, making it stiff and constructed. So meaning, this means that due to extreme heat or high temperature, that the dead body is exposed. It will cause the body to experience a rigor mortis or the stiffening or hardening of the muscle. And that's the concept of heat stiffening. So like for example, John, kuan iton patay bali na nigahi kay tungod sa kapaso. So chemical burn. All of these three acids are the vital for burning the body. This because it contains chemical that may react towards our body if ever there's direct contact happen, and through the some change of color may occur depending on the chemical use. First is sulfuric acid. Most intense action causes considerable amount of destruction of the tissues with formation of a blackish brown slough. So, masabot ang mga sulfuric acid. Then, the second is the nitric acid, cause a yellow or a yellowish brown slough, spot of a yellow color seen on the skin. Third, hydrochloric acid as a destructive as a sulfuric acid or nitric acid. Produce a localized ulceration of red or reddish gray in color. So next please. Electrical burns. The main cause of the death is electrocution is shock. Electrocution is divided into three groups according to the bolts. So an electrical burns, first a person died to due electric shock that also causes the body to burn. The first is domestic voltage. This is the voltage of domestic line which varies from the country to country. So meaning, mostly these kinds of voltage located at the street or even houses where the main supply of the electricity is located. Second is the high voltage. High voltage is used to operate heavy machine, toll, train, and electric grind network. So meaning these are the voltage that are usually used for factories or any kinds of companies that operates heavy equipment that is mainly operated by electricity. Next please. Third is the lightning. So electrical change in the atmosphere usually occurring during thunderstorm. It is about 100 million volts and 200 amperes. The effect of lightning are due to both the passage of a very high potential electricity producing electrical burns of death due to the blasting effect or rapidly expanding air producing larentin and distortion of the body parts. Death from lightning is accidental. So meaning basically guys lighting is caused by a natural phenomenon. However, it is dangerous due to its highest voltage that can instantly destroy life if ever it will happen.
So, change of atmospheric pressure. The normal atmospheric pressure at sea level is 100 mm of Hg which is conducted to help when a person goes deeper underwater, the pressure becomes greater. So, ang normal atmospheric pressure at sea level daw is 100 millimeter of Hg, which is pag ang tao daw is mo go deeper underwater, mas mataas ang pressure. So, the gases in the body such as oxygen, carbon dioxide, and nitrogen will accumulate and liberated in circulation, blocking small caliber blood vessel. Gas bubbles block the blood vessels, producing flying to the distal part supplies by the down, and this condition is called air embolism. So, ang katudang ato ang gases sa ato ang lawas such as oxygen, carbon dioxide, and nitrogen is maipon and kanaang they are free to kuana circulate na mag-cause sa pagka-block sa kuan mga blood vessel. So ang katong mga gas bubbles na mo block sa blood vessels is ginatawag to siya nga air embolism. This condition is further accelerated when a person underwater goes abruptly from increased pressure to normal pressure condition. So, for example, nasa underwater ang isa ka tao, then ang pressure man is taas. So, pag mukalit na siya dito, o mukalit ra og pasaka nga mabalik ang iya ang mabalik sa normal pressure, then mas mo mo lala tong mga gas bubbles sa imuhang lawas. So, sa post-mortem findings or sa autopsy findings, ang katudang mga gas bubbles is makita sa different organs sa atong lawas. Kaya syempre, biskan asa naman to circulate. So, amo yan to. When a person goes higher and higher in the atmosphere, the pressure becomes lesser and lesser, and the oxygen in the air becomes lesser. This condition is seen among mountain climbs. So, kabantay mo anang kuan, mga mountain climbers o bisan kita nga pag pag naata sa kana ang pinakataas is kanang maglisod na ta og ginhawa. Kabantay mo ana.
Yes, yes, yes.
So, maong maglisod ta og ginhawa sa pag naa ta sa pinakataas is because pag higher ang altitude, then fewer naalay fewer oxygen molecule. So, less lang ang oxygen mo nang maglisod ta og ginhawa. Next please. So, sa beta, sumoto mo lapot siya sa malapot siya sa paper pero mas tapos siya sa aluminum kung sa materials. Pero pag sa human body, maka-damage na siya og deep sensitive tissue sa ato ang lawas. And then ang sa gamma rays, pag sa material, mo lapas siya sa papel, mula po siya sa aluminum pero ma-block ra siya ng mga anang lead. So dili na siya mulapos pa, tama na siya sa lead. Anya pag sa human body maka penetrate na sa ato ang lawas and mulapos na siya sa atong outer skin sa mga tissues nga and then mapiktuhan ang ato ang mga internal organs o bones. So mo nang pag kanaang magamit galit ta og kaniang materials nga naay radiation, dapat magamit gid ta og mga gear ka ng protective materials para dili ka madaog. So, next slide, please mention. Infanticide or neonaticide, killing of a child less than 3 days old. So, here are the evidences in infanticide. So, number one, that the child was born alive. So, dapat ang sa case infanticide, dapat ang bata is napagawas gyud or na anak siya na buhi kay pag for example lapas sa tiyan so dili na siya matawag og kuan dili na siya matawag og infanticide. And then ang ikaduha, that the child was deliberately killed. So ang bata is giplanuhan gid na giplanuhan gid papatay or kanang basta iyahang ang naging siya intention nga patayon niya ang bata. And then ikatulo is that the child was less than 3 days old. So sa infanticide na case, ang oras is importante gyud kay for example ang bata is namatay more than 72 hours or more than 3 days na, so dili na siya matawag na infanticide bisan pag kuan tibali 72 hours man anya na 73, so dili na siya masulod sa infanticide. So either naano na siya dito sa parricide depende sa relationship sa bata. So next slide. So how the crime of infanticide is committed? Number one, by omission or neglect. Ana ang wala nimo gibuhat or gipasagdan na nimo ang bata. So letter A, failure to ligate the umbilical cord. So amo yaon katong pusod sa bata kanang sumpay sa bata. Pag dili na nimo maputol, kanya mag-cause og pagkamatay sa bata. So makasuhan ka ana og infanticide kay pag once na ang kanaang sumpay sa pusod sa bata is dili maputol, do dili pa dayon mapatay dayon ang bata pero magkuan na siya na siya serious problem na pwede makapatay sa bata. Ikaduha, letter B, failure to protect the child from heat or cold. So, ang diri is example, ang bata pasagdan ra ya namugnaw na didto wala gi saninaan ang inangan pasagdan ra niya. Nya kana kung ang bata gihilantan, gipasagdan ra sa inahan wala gihatagan og tambal, pero syempre dapat less than 3 days old or less than 72 hours. So pag inana pasagdan ra niya dili pa ingon ugatas, then makasuhan ang inahan og infanticide. Katulo, C. Failure to supply the child with proper food. So kanang pasagdan ra ang bata dili pa kanon. So isa pud ang makasuhan ang inahan. Next please. So ikaduha by commission. So ang by commission is imuhang buhat sa bata. Pinakauna is inflicting physical injuries. So kanaang kasakitan nimo ang bata like kanang bunalan, nga sobra na kaayo nga makakos ng pagkamatay sa bata. Next please, suffocation kana ang example ani is dili nimo pag ginhawa ang bata like kani ang tabunan nimo ang iyahang ilong or baba nga dili siya makaginhawa or kanang tabunan nimo ang naong sa bata og unlan na dili makaginhawa ang bata nya mamatay. So isa po na sa kuan makasuhan og infanticide. Strangulation kanang kuan pitlokon ang bata nga mag-cause sa iyang pagkamatay. Drowning kana ang lungsan ang bata or kanang kitaan sa inahan nga ang bata is hapit na malungos na ipasagdan ra. So amo yaon. Then poisoning kana ang tangan nimo og lason ang pagkaon sa bata or imuha siyang hiluan. So amo raon. Yeah, thank you.